Okay, hello. So my presentation is on postpartum depression and its impact on early childhood development. So most of the sources that I looked at saw early childhood development as between the ages of 0 and 3 years old. So that's kind of what I'm focusing on. And then a bunch of studies focused on postpartum depression as just the 2 weeks after giving birth, but it varied within weeks and like a few months, but it was mostly a short period of time right after giving birth. So let's go through. So postpartum depression, also PPD, is a type of depression after giving birth. So this includes feelings of sadness, anxiety, and problems bonding with the child. So it may not even have anything to do with the child, but right after they're born, the feelings of kind of deep sadness and hopelessness just come after birth, even if you're excited to have your child, and even if those symptoms might go away later, they are present sometimes after giving birth. So these can cause problems bonding with the child. And so you can only imagine how that would impact how you're treating the child. So PPD has shown to have critical impacts on early childhood development. And so I looked at a bunch of different studies, and a bunch of them say that there is evidence supporting the statement, but some of them don't control for mothers who are suffering depression during pregnancy or just had depression in general. And there were a bunch of factors that just weren't controlled for. And so I'll explain that in implications for future research and stuff. But psychotherapy and medication are the main interventions for this disorder, which I was looking at. Let's see. So there's been a lot of research already done on antenatal/prenatal depression and any associations it might have with early childhood development. Many studies have found evidence to support the conclusion that children of postpartum depressed mothers are at higher risk of internalizing and externalizing problems in the future. That's just one thing that a bunch of the literature was saying. So the theoretical perspectives that this topic has to do with are first, attachment theory by John Bowlby. So the child's attachment style is formed through neglect. And so if the mother is showing signs of postpartum depression, then they are most likely interacting with the child in a way where the child feels neglected. And so the child might be led into potentially having an insecure attachment style. So of John Bowlby's, it would be either anxious resistant or anxious avoidant. And then also Erikson's psychosocial development theory. So there are two stages of his psychosocial development theory that this child would fall under. So there is trust, mistrust from 0 to 1 years old. And then there is autonomy versus shame and doubt. So 18 months into 3 years old. So for trust versus mistrust, there is a lack of a sense of trust fostered between the infant and the mother, kind of like how I was talking about how there isn't a bond and the child isn't feeling a lot of support from the mother or just even FaceTime with the mother. So there's a lack of sense of trust fostered between the infant and the mother. And then also there is inconsistent care the child might be feeling. And so they might feel mistrust and insecurity. So that is within the trust versus mistrust stage of Erikson's theory. And then for autonomy versus shame and doubt, in early childhood, the child enters Erikson's autonomy versus shame and doubt stage of his development theory, and toddlers should be exploring their autonomy and their sense of self, so kind of exploring their independence. But with a mother who experienced or experiencing postpartum depression, there may be a lack of encouragement or on the other side, too much control over the child while they're going through this stage. And this could result in self-doubt and impaired social functioning for the child at this age. So these two stages are critical for trust and independence. And so if there are issues with the mother and the bonding to the child, it's very critical that there's early intervention with this, and that this doesn't end up turning into insecure attachment styles or lack of independence, or any sort of insecurity. Yeah. So I did a review on a few peer-reviewed articles. There has been a lot of research already done on this topic, and any associations it might have with early child development. So many studies found evidence to support the conclusion that children of antenatally / postpartum depressed mothers are at a higher risk of internalizing and externalizing problems in the future. So that's important. Okay, so then developmental influences, there are quite a few. So for cognitive development, postpartum depression negatively impacts the child's ability to learn critically. And this is because, again, of a lack of maternal interactions. So this could lead to the child feeling neglected, and then cognitively, this could lead to impairment of their executive functioning and memory later in life, which I thought was crazy. Just that it seems like a little bit of neglect can impact how their brain is functioning later, and like even impact memory. Also under this, the children have higher stress responses to new situations. So this was shown to be linked to postpartum depression in the mother. And then brain development and stress, I will elaborate on that later, but evidence is showing that postpartum depression affects brain development and the HPA axis regulation. And then socio-emotional development. A depressed mother may be less emotive with their child, which could lead to the feeling of them feeling neglected again and developing an insecure attachment style. So as we said, and then with less attention from the mother, the child might exhibit more symptoms of neglect, like poor social skills and emotional regulation. So already we're seeing so many signs of different things that just neglect can cause with a child developing at a young age. So on top of this, postpartum depression can also result in reduced coping skills in the child. So this kind of goes back to issues with attachment theory and how they can be insecure and kind of not understanding social skills and coping skills with themselves. So their independence is kind of out of whack. But all of this depends on the severity and length of maternal depression. And then I'll talk about later how a lot of these studies weren't longitudinal. And so it was hard to see kind of where the depression was coming, whether the mother already had it, how long it lasted, and stuff like that. And then there's contextual variability. So the study that I was looking at that showed me developmental changes shows evidence to support the idea that lower socioeconomic status children may feel these impacts more strongly than higher socioeconomic status children. And I presume this is because there is maybe more hands-on in a higher socioeconomic home. And so if the mother is having postpartum depression, then maybe the nanny is stepping in and providing that support and negating that neglect that's possible for the infant to experience. Next. Okay, so there's impact on individuals. So there's two main impacts. So it's infant temperament and mother-infant interaction. So with infant temperament, there are negative and withdrawn responses from the child. So they are not feeling a lot of support from the mother and not feeling like the mother is someone they can go to. They are feeling reduced engagement and joy, and they are more fearful and emotion-producing scenarios. That also goes back to reduced coping skills, poor social skills, and emotional regulation. So these all kind of tie in with each other. And then the mother-infant interaction. So there's inconsistent interactions between the mother and infant, and that can impact infant emotional regulation and responsiveness. So as I said. And then also just to elaborate on the brain development and stress, evidence shows postpartum depression may affect the brain development in a lot of studies, actually. And they were elaborating on how brain development can be seen as affected way later in life, at different ages they were looking at, but it actually is something that people do pay attention to and people are seeing. So then the impacts on society was, it was a little bit hard to see where these were poking out of, but in general, healthcare costs are going to be raised if mothers are neglecting their children. So children need early intervention, which is important. They maybe need more schooling. They maybe need more support outside of school. They maybe need social skills training, any sort of therapy. So there's economic consequences with just money draining towards things that don't need to be maybe spent money on, like things to make up for that neglect when the mother's depression could have been handled earlier. I don't know how, but in theory it could have been. And then reduced workforce productivity, so that child ends up having a reduced work ethic, and then increased behavioral issues. So you weren't taught properly. You have a insecure attachment theory, insecure attachment style, and your independence is kind of out of whack. So kind of general things that impact society, but nothing's too specific. Okay, and then the intervention